Hi everyone, this is Meir Schneider. I was born with low vision. I was born with cataracts that were poorly operated. Specifically in my case, they were operated too late and they were operated poorly, in that most of my lens is scar tissue. I was raised reading Braille, and after doing eye exercises and improving my vision significantly to the point that I can read normal print, even though from near distance, to the point that I can drive without restriction, that was after doing a lot of work. My message to the world is that we need physiotherapy for the eyes. I want to talk about one of my clients, Aurora is her name, who came all the way from Portugal to work with me. She did it 6 years ago after a successful phone session I had with her, and after that she could cross the streets without problem. She had several unsuccessful cataract surgeries, and as a result she got glaucoma attacks, and 95% of her optic nerve was destroyed, and the ophthalmologist was afraid that the last 5 will be destroyed as well. But as a result of working with me, those 5% remain. And she had so many skills that she could cross the street on her own. Then she came to me just last year for the month of September for full work with me. Can you throw me the ball? I've shown her this ball with a lot of colors, and we threw it back and forth. And maybe you can come here and I'll demonstrate. Aurora is not here, but here is Jean. That's farther than I did with Aurora. Come closer to me. Yeah. And we threw it. In fact, there's Aurora document in our website. And we took her to the ocean, and she loved seeing the waves. And amazingly enough, she could see rocks. And after that, she could read big signs. She left with less fog in her vision and seeing large print. That was amazing. And so what I want to tell to all of you is that low vision can be improved, like the case of the wonderful lady who suffered from blastoma and then had surgeries that blinded the one eye with which she could see because one was attacked by blastoma. And I've shown her how to use her periphery. Like the cancer kid that I'm meeting, that I'm helping him also use his periphery. What we don't have for the eyes is what we should have. Coaching to use the vision we have. Not only to use it so we can function, but to use it so we can see better. So learning to look at details, that's one thing I've learned. I remember sitting and looking at my fingers and the spaces between them. And I did it for hours until my eyes started to look. Because quite often, engaging between the brain and the eyes can help you see better. And even the man who takes this video from me was born with great vision difficulties that he learned to manage, and he learned to improve his vision in spite of them, in spite of a damaged optic nerve. So many people are considered to be dysfunctional with the vision when actually they can be functional. And the difference is working. For example, I had dark glasses, but I learned with this sunning exercise where I close my eyes and move my head from side to side. The eyes are closed, but I was able to adjust my eyes to the sun, strengthen my pupils, and see much better. For example, my eyes were moving rapidly for about 300 times per minute, and with relaxing my eyes for hours and listening to music, I was able to reduce this involuntary movement, which is called nystagmus. And so my fate is so different than it would have been if I would continue to read Braille. But I had a lot of energy for this. I was the quickest Braille reader in the state of Israel. And my energy translated itself into working on my eyes. So it takes willpower, it takes the right technique, and the right technique is there. And now that we have Low Vision Month, I really want people to devote some thought into how to improve low vision. and do the right exercises to do so. Many blessings from the friend of the world, Meir.